Thank you. And now I'd like to introduce our presenter and host today, a member of the ABA Meadowlands Council for many years, and a great supporter of networking and all of our members throughout all the councils. CEO of Scirocco Insurance Group, John Scirocco. John?
Thanks so much. Thanks, everybody. When Bob and I talked about what's going on in the healthcare industry, this is such a hot topic and such a timely one. So I think today's going to be a great opportunity for everybody to get a handle on what's coming. You know, they use the term Affordable Care Act. A couple of quick things. It's going to be less affordable for everybody. The care is going to diminish. The act is an act of help. And that's really what's coming. Yesterday we went through a dry run. Dan Castrillon is going to be the main presenter. Dan runs our corporate benefits department. Liz Gagin is an associate in our division, and Rich Dotson's one of our sales reps. They're all tall than most of us here for a reason, okay? But I wanted to at least start off with Dan will get into it real quick right now. The key issue to this is to be understanding it and being prepared. And there's a lot of misconception as to what you can and can't do. Yesterday we were going through a dry run on these slides, and it's like, you know, you get angry. You know, you say, you gotta be kidding. This is gonna hit us as well? It's just mind-boggling what's coming. And to understand it, you know, knowledge is gonna be power. It's gonna be power for us to understand next steps as small business owners, larger business owners. It's gonna affect everybody from 2-person firms to 80-person to 35 who think, well, I have a bunch of part-timers that can get away with this. You're not gonna get away with it. So we really have to understand it and at least take that information. And we're only going to be here as a resource for everybody in the organization at any point, any time. So with that, I want to turn over to Dan Castrillon. Dan will start off. And this is going to be a free-flowing dialogue. And I may push things a little quick because we did it in 45 minutes and we were flying. I don't want this to be a 2-hour session, as Dan knows. So I think what we're going to do is anybody has a question, just throw it right out there. This is not, I'm going to have a Q&A at the end. But for our purpose today, it should just be a free-flowing conversation on the things he's going to start presenting. Rich will chime in, Liz will chime in on certain issues, and we're here to kind of answer the questions that you have. So with that, Dan Castrillon.
Good morning, folks. This is Rich Dodson. And Liz Gag.
Dan, can you just stand? She's going to YouTube this.
Oh, you want? Well, I'm trying.
Yeah, just stand here.
Don't throw me off. I got a routine. As John said, can everybody hear me in the back? Okay, great. I've been told I talk too loud sometimes, but by way of preamble, let me tell you a short analogy I like to give when I give this talk. Several months ago, there was a religious gathering at Giant Stadium. 93,000 people came together to celebrate a group of Talmudic students having taken 7 years to read 2,700 pages of the Talmud. Does anybody know how big the Affordable Care Act is? 2,700 pages. And we haven't had a graduation party yet. Items we're not going to cover today, or we're going to cover just briefly here because they're either in play right now and we've all been dealing with them. They're a talk unto themselves. So let's go through it quickly. Grandfathered plans. If your plan was in effect prior to 2011 and you haven't made any changes, which is highly unlikely because the carriers are systematically weeding out the grandfathered plans. But if you have a grandfathered plan, you don't have to do anything. Quick question. How many people here either own or belong to a firm with less than 50 employees? Okay, that's going to become very important as we go through it. Preventive care. Under the Act, and starting in 2011, if you go to the doctor for your usual checkup, or your children go to the doctor for their annual school physical, there's no deductible, no copay, it's paid 100%. A word of caution, however. If you go for, say, a colonoscopy, and the doctor finds a little something and sends something out for pathology, it drops out of preventive into diagnostic, and then you're subject to your deductibles and co-insurance. So please, if you go for a preventive visit to a doctor, make sure he codes it as such. Health plan fees. They don't call them fees anymore. They don't call them taxes anymore. They call them fees. I won't get into this in great detail because the whole act is rife with new taxes and new fees. For instance, if a plan renews next year with no increase in premium, there's going to be an additional 4.2% just in new taxes or fees. Discrimination testing. It used to be you could kind of fiddle with who's going to be covered, who's not going to be covered. That goes away. It's going to become very, very strict as far as discrimination. Small business tax credit, that by all means expires this year anyway. It was a very little used credit because the average income of the firm had to be less than $25,000. Accountable care organizations, a good concept where similar to the old HMOs, where everything is done in one place. Mandatory loss ratios. Very quickly, if a plan or a book of business has a loss ratio of 80 or 85%, depending on the size, the carrier had to refund the difference. But again, that's a whole talk unto itself. Affordability, we'll touch on that briefly later on. Medicare, Medicaid changes. Again, it's a whole talk unto itself, and we can, if you want to sidebar that, we can talk about it. And finally, we're not going to talk about the 2012 presidential election. That's really a talk unto itself. Here in New Jersey, we were basically ahead of the curve. I know a lot of people complain about the cost of medical insurance in New Jersey, and that's basically because we implemented a lot of the things that are contained in the Affordable Care Act beforehand. Pre-existing conditions limitations, all but eliminated in New Jersey. If you went from one plan to another, you didn't have pre-existing conditions if you had plans. So it was it did away with job lock, where people were afraid to leave because they may lose their benefits going to another plan. Unlimited major medical maximums. We've had that in New Jersey for the longest time. Dependents to age 31 in New Jersey. Now, it's dependent to age 26 under the federal law, but from 26 to 31, they could stay on the plan paying their own single premium at a discounted rate, about 68% of the normal single rate. Mandated benefits, pregnancy, mental health, etc. Those are already in play in New Jersey. Again, as John said, if you have any questions or any comments, please sing out. We'll cover it then rather than try to remember it for the Q&A. (2013) compliance deadlines. Now, we're going to cover some things here. There are certain things that are going to happen in 2013 that you have to prepare for 2014. That's what we're going to try to cover here in these slides. Employers must report the aggregate cost of group plan coverage on each employee's Form W-2. Now, originally, it was every employee in the world had to have this done, but that soon became impractical. So this is now limited to firms that issue more than 250 W-2s, not 250 employees. If a firm issues more than 250 W-2s, high turnover firms, maybe part-timers, if you issue 250, you must put the cost of group insurance coverage on their W-2. Guess what that's going to lead to? That's right. Doesn't change the tax rules. It's still, healthcare is still a tax deductible item for the time being. It's mandatory for the 2012 tax year. It's going to have to be on your January 2013 W-2s. That should have been done already, as I said. There's kind of some of the things. Again, for small employers with less than 250 W-2s, doesn't have to be done. Full-time equivalent employees. a new concept that the government is brought forth. As John said, a lot of firms, when this first came out, said, well, I'm just going to cut back my full-time staff and hire part-time employees. Well, they were ahead of us on this one. We're going to cover what's going to happen with full-time equivalent employees, but I just want to cover how that's computed, because you must keep track of it this year for implementation next year. Calculated based on, in 2013, the number of total hours worked divided by 130. Okay, let's go through an example. Firm has 20 full-time employees. They have 47 part-time employees that work 24 hours a week, okay? Because in Jersey, 25 hours is considered a full-time employee anyway. So, 47 employees at 24 hours a week, that leaves a total number of hours, 4,850, divided by the 130 gives you 37 full-time equivalent employees, or a total of 57 employees. Now, you only have to provide coverage for these 20. You don't have to provide it for the full-time equivalent employees, only for the... Now, if you have a payroll provider, they should keep track of your full-time equivalent number. And again, you should do this every month just to see what you're coming up with. This is a slippery concept. Anybody have any questions on it?
What's the purpose of it? Just to get to the threshold of employee count?
That's why I asked the question before, who employs 50 or more employees? Because there's going to be a big demarcation between under 50 and over 50. You're going to see a lot referring to a small employer as under 100. But in New York and New Jersey, since we're what they call reform states, 50 is the magic number. Okay? Tom? Summary of benefits and coverage. I'm sure a lot of you have seen what they call a summary plan description that outlines your benefits, basically. This is in addition. You're still going to have to provide a SPD, a summary plan description. Now you're going to have to supply a summary of benefits and coverage, a simple and concise explanation of coverage. And this applies to both grandfathered and non-grandfathered plans. So even if you're one of the very, very few that have a grandfathered plan, you're going to have to comply with this rule. A model template and guidance are available. That's not quite true. They're still working on it. Gives you instructions, sample language, uniform glossary of terms. Final compliance was March 23rd. They postponed it. Okay, and it's still up in the air when it's really going to have to take place. Your health plan provider should provide it for you. Okay, unless you're a self-insured plan, then your administrator should provide it for you. Tom? Yes.
What was it that was required by insurers? I think it was for September 1st. Wasn't there something?
That's the notice. We'll get to that in a little bit. Yeah. There's all sorts of things that were supposed to be provided and have been pushed back. We'll talk about that too.
Under the summary of benefits, is that required to be given to each employee and signed off and then put in their personal?
We'll get to that in a minute. Okay. This SBC is provided to health plans by the carrier. In other words, if you have Horizon should supply you with your specific SBC. Upon application, if you change plans, before the first day of coverage, if there have been changes, when a policy is renewed or reissued, and if you request it. Now I'll get to your question. The plan must provide a summary of benefits to enrollees already enrolled in a plan for each benefit package. Now, I'm sure many firms here have more than one plan. I know at Scirocco we have 4 plans. So each employee must get an SBC for each of the 4 plans, okay? Annually at renewal, okay? Or 30 days before the new plan year, with enrollment application. Again, we're going to get into automatic enrollments later, but with the enrollment application before the first day of coverage. In other words, you have a new employee, you have a 30-day wait, 60-day wait. Before they actually become available, become enrolled, they have to get it. To specially enrollees.
Yeah, well, I have a question for you. This is making it arduous in your HR side. That's for a small company.
Oh yeah. This is whether you're 52, 150, whatever. You've got to provide this to the employee. But again, the carrier should provide it to you. So it sounds onerous, but you're going to get a stack of them. We're going to get a PDF from the carrier to give to each employee. And the employee can request it. And if they request it, you must give it to them.
Can this all be done electronically, or do you actually have to have a paper?
You can give it to them electronically if they can receive it. Okay?
Do you have to document that they received it, or they have to sign off? And
No. It's if you make a good faith effort, and everybody in your firm gets it. One employee says, "I didn't get it." That doesn't.
Yeah, Liz, what do you think?
The other thing is, not only is it your employees that it's your responsibility to get it to, it's also the participating dependents. So everyone that is enrolled on the plan, a spouse, a child, someone that's,
someone at college or something?
someone at college, exactly, thank you. So if you have an employee that has a dependent child that's at Penn State, you have to somehow see how you can get it to that dependent child. That's the wide-reaching aspect of this piece, is that they're putting this onus on the HR administrator, on the employer, to ensure that everyone gets this. You can send it electronically, you're not required to get a signed return receipt or anything of that nature, but if you have the information, there's an expectation, but there's no fines involved with not getting it to people that you can't get it to.
The key
However,
factor is
there are.
good faith effort.
Yes.
If you've made a good faith effort to get it out to everybody, and somebody says, "Well, I didn't get it," that's going to exonerate you. The standards for the SBC: it cannot be more than 4 double-sided pages. That's clear and concise. Okay. 12-point or larger font. This is all very specifically laid out. That's why it's 2,700 pages. May be color or black and white. Can be paper or electronic form, to answer your question. And there will be a template available when they finally decide what really has to go into this. Language, easily understood language. Culturally and linguistically appropriate manner. So if you have a high Oriental population in your group, you have to put it out in Mandarin or whatever dialect is there. Translations are available in many languages from the government. Okay. So moving on from the SBC. Any questions on the SBC before we move on from it? Remember, you have to give the summary plan description and the SBC together, both of them. A 60-day notice rule. If you make any material modifications, not in connection with renewal, because with renewal you're going to give out the SBC anyway. You have to give a summary of material modifications or an updated SBC. You go from a $500 deductible to a $1,000 deductible, or you go from a $20 copay to a $50 copay. Those are considered material. Okay. Material modifications include enhancement of covered benefits, material reduction in benefits, more stringent requirements for receipt of benefits. They don't quite know what that means. Must be provided at least 60 days before modifications become effective.